Hi everyone, Dr. James Marcum with another biblical prescription for life. Today I want to give us some new insights into depression. You know, depression is affecting more and more people in the world, especially since the pandemic, since some of the new trends in social media. It seems like depression is rampant. It's been estimated that 10 to 15% of all people will suffer from depression at some point in their lives. And the World Health Organization shows that 264 million have depression. I'm going to say that this number is probably vastly underestimated. So I'm going to give us some new insights into depression today that might help you quite a bit, or it might help those you serve. You might be able to share this with someone else that might be struggling with this, wanting to know what to do. So stay with me today on this subject. But before we go on, I want to bring us to a biblical prescription. This is from one of my favorite writers, Dr. Luke, who is transitioning from being a physician into evangelism. He writes in Luke 10, verses 36 and 37. So which of these three do you think was a neighbor to him and fell among the thieves? And he said, he who showed mercy on him. Then Jesus said to him, go and do likewise. So this was the story of the three Samaritans. Remember, the three people that passed. I wouldn't say they're three Samaritans, but it was a parable of the Good Samaritan, the one that helped this injured person by the side. And this questions, he says, who do you think was neighbor? So then Christ says, go and do likewise. A recommendation from God of the universe, a biblical prescription. Basically a biblical prescription to take care of our neighbors. Go and do likewise. A wonderful prescription. And that's what I wanted to focus on today, because we want to take care of our neighbors no matter where they're at, no matter what they're suffering from. We want to give them something to help them, to help heal them. Now, on the story of the Good Samaritan, remember, he got beat up. But a lot of people out there are getting beat up by life. And many people will see that this is happening and they will just walk on by, okay? But I'm hoping today that all of us will recognize that there's people that are hurting and that are beat up by life in likewise ways. And they carry the diagnosis of depression. So many people come from it, and there's no blood work or urine work that tells if a person might be depression, but that they have these criteria, and they have these 5 criteria for a major depressive disorder. And people have to have these to get this diagnosis for a 2-week period. And at least one of the symptoms must be a depressed mood or a loss of interest or pleasure. So here are the 5 symptoms that might describe the clinical diagnosis of depression. Depressed mood most of the day, or nearly every day. This is reported by the individual. Markedly diminished interest or pleasure in almost all activities. Significant weight loss, and that's in a person that's not dieting, or weight gain. Insomnia, or hypersomnia, so either sleeping too much or too much, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think, concentrate, or make decisions, or recurrent thoughts of death. So to have a diagnosis of depression, a person must experience 5 of those symptoms during the same 2-week period, and at least one of the symptoms must be a depressed mood or loss of interest or pleasure. So in our lives, as we're traveling along, there are many people on the roadside that have been beat up by life and might suffer from these. So I want to find ways to, as this text says, to have mercy on these people, to help them, to help other people help them, because we want to take care of them in these dangerous situations. So it might not be that they're beat up physically, but they're beat up in their brains. And sometimes that can be worse. So that's sort of a definition of depression, but what can we do about it? Well, first, a little education. Sometimes depression runs in families and there's genetic components, but sometimes it can just be because there's a change in the neurotransmitters. So the neurotransmitters that affect the way we think become imbalanced. Those transmitters, probably the most common one we hear about is serotonin, but there's also dopamine. But other things can also affect our moods, including our hormonal balance, how the thyroid's interacting with the brain and our other hormones. Sometimes there's trauma in life. Sometimes we can have these feelings just because of social isolation. We're not interacting with people. Sometimes people that are chronically ill from other problems can have these symptoms as well. And of course, we are hearing more and more about substance abuse, whether that be alcohol or drugs or any toxin that we're putting in our body that can damage our brain, upset the neurotransmitters in the brain. So understanding the cause of these symptoms is very important. A few years ago, I read this book, Anatomy of an Epidemic by Whitaker. You might want to take a look at that book. And when depression was being developed, when it was being described, the real solution that this book looked at was whether a medication solution was the best way. Well, now I'm giving you some insights to saying that many people for depression that's not severe, that's not genetic, think that we should look at other things first in treating depression. So when we see someone on the road, we need to help them maybe in a little bit different roads. So that might be a good book to look at and read if you want to learn more about this or share. But I want us to focus on a couple things today. One is the neurotransmitters that affect our moods. We want to increase the good ones, the good neurotransmitters, oxytocin, endorphins. We want to increase serotonins. There's a disbalance in this. And all of the medications that are out there, they don't make us make more neurotransmitters. They just change the way the neurotransmitters hang around the synaptic areas and the clefts. So that's one thing. So we want to not only talk today about neurotransmitters and how we can optimize those to improve our moods, but we want to talk about other ways to optimize our brain function so it's doing better. And we also want to talk about some of the world things that are going on that might stress a brain, some of the toxins, some of the inputs, some of these things that are all around us that cause inflammation. Inflammation causes neuronal problems. We can't signal as well. We don't get as blood as well. We don't get waste in and out of the brain. All of this can come from all of the stress that we're under. So we want to talk about those three things: neurotransmitters, how we can optimize our brain function, and how we can deal with some of these stress issues. So first, to increase our neurotransmitters, we want to minimize things that would damage us. So we want to minimize the toxins in our body. The most common toxins that can affect the brain are the drugs. We see that with fentanyl. We see this with alcohol. We see this with some of the other drugs out there. Cocaine is another one. But also, people don't think about food as toxins to the brain. So foods, processed foods, heated fats, they make glycosylated end products. All of this processed foods, processed fat, heated fat, these make these end products that cause inflammation. So we know that to minimize toxins just from a food source, we want to eat fresh fruits, vegetables, nuts, and grains. More on that later. So when we eat healthy, we also eat more fiber. There's 1 trillion bacteria in the gut that helps us make neurotransmitters that help us decrease inflammation. The average American doesn't get enough fiber. And when I say average, it's been estimated that only 10 to 15% of people get enough fiber. That means about 85% don't get fiber. So when you don't get enough fiber, you're not making neurotransmitters that we talked about as well, and you're getting lots of inflammation, all which affect the brain, which could cause inflammation, which could cause these types of mood-altering symptoms. So just eating fiber, for a woman, 25 grams is a minimum. For men, 31. But the more fiber you get, peels, take fiber supplements. The more fiber we get, the more neurotransmitters, the less inflammation. And we get that from a whole food, plant-based diet. When we're eating this way, we also minimize some of those inflammatory foods that can cause inflammation in the brain, which also affect our moods. So that's one way, just by nutrition, that we can increase our neurotransmitters. So what are other ways that we're not doing to optimize brain function? Well, getting enough rest. There's been estimated that only 30 to 40% of people get 7 hours of rest. We need rest for optimal brain function to help the neurotransmitters, to help our moods. We also need to exercise. Did you know that it's been estimated that only 1 in 4 people get enough exercise? So 75% of people don't get enough exercise. When we exercise, we can remove harmful waste, we increase oxygenation, we make a lot of good products that the brain needs. So just exercising. Then simple things like getting outside, getting enough vitamin D, making sure you have enough B vitamins in your life. All of these things can help the substrate of the brain doing better. So if you think about it, if you don't exercise, which 75% of people don't do, if you don't rest, which many people don't do, if you don't do things like eat healthy foods, many people don't do that. If you don't drink enough water, water is very important for the brain too. If you don't do those things, the neurotransmitters, the brain doesn't work right, our moods are going to be affected. So I would work on those things first rather than to jump on a pill that affected the synaptic utilization of serotonin. There's also been a lot of research that's been shown about insulin sensitivity. Well, about 42% of people are obese, 70% of overweight. When we do this, our sugar doesn't get into our cells as well. We have energy problems. We make extra insulin. All of this now is being shown to affect the brain. Glucose is the main energy source of the brain. Well, we don't have enough glucose and it can't get into the cells. Of course, the neurons, the neurotransmitters don't work as well. That's going to affect our mood as well. So there's been a lot of work into looking at all of these metabolic issues to treat insulin resistance. Now, exercise treats that. Eating healthy diets do that as well. There's been some people with mental health problems that are now going on these ketogenic plant-based diets that's improving their utilization of glucose. That helps quite a bit. Some people are even trying some intermittent fasting to help improve insulin sensitivity and glucose utilization in the brain. So, of course, all of these things are basics that affect our brain function, but these are harder to do. It's much easier for people to take a pill, and unfortunately, the pills don't get at the root problem and sometimes create more problems than they're worth. A recent article that I read talked about using different herbal nutraceuticals and how that might help depression. Of course, I would do all of these substrate things first, I work on my simple things like, just imagine, just exercising, eating, getting fiber in your diet, and getting enough rest. That might solve a lot of people's problems, but they looked at the different nutraceuticals that are out there. They did a meta-analysis. That means they looked at about 192 articles, 17,000 patients, and they studied them, and they saw which of these nutraceuticals, natural substances, worked well for depression. And they didn't even do all these other things that we talked about. But they found out that saffron works pretty well. Turmeric works well. The omega-3 fatty acids, all of these help the brain functions. The supplements EPA and DHA, we can get those in algae-like things. There's another one that they looked at a little bit called St. John's warts. Zinc helped a little bit. Foods with tryptophan, because tryptophan is converted in the body to serotonin, which is a neurotransmitter. And then they talked about some of these other things. These all work just as good for mild to moderate depression as the antidepressants did, with lots of less side effects. So that was another thing that helped in the treatment of depression. But in looking at this in a new approach to this is getting at the cause, try to improve the brain's function, get our body to make more neurotransmitters, and then thinking about this text, about if you see people along the side of the road that might be suffering from depression, don't walk by them. Try to find something to help them. And it said, then Jesus said to this man that was asking about this, he says, go and do likewise, to take care of people, to take care of neighbors. Who is our neighbor? Everyone. And when we serve other people, we get health benefits ourselves. When we serve, we're in a state of worship. So that's another thing I think is very valuable to people that are suffering from these mental health problems. And we know that when people worship, when they go to the Word of God, when they plug into Christ as their Savior, when they dig into this and depend on this to help them, empower them to understand why they're suffering from these things, understanding that it's happening in the brain. There's something they can do. There's people out there that will help them, that will pray for them, that won't walk by them, that will try to offer them something more, to go to do likewise, to help our neighbors. So we want to help our neighbors that are suffering from depression. We want to be good Samaritans. We want to not ignore the people that are neighbors that might not be beat up physically, but are beat up mentally. They're out there, more and more out there. We need to help them. So I want you to share this video with them to empower them. I want you to pray for them. I want you to pray that when you see someone that you need help, at least you can walk by and say, listen, I got a YouTube video I can share with you that will give you hope. I will pray for you. I will do something to help with you. Hey, would you like to read a text? Would you like to get into worship? All of these things, I think, is the way to initially treat and give you insights into depression, which is affecting so many people. And when a mind is depressed, when it's not doing good, it has a hard time receiving truth. And it gets confused, and it's more easy to be deceptive. And then we start looking for other things to treat ourselves, to make us feel better, to bring our good feelings back. So we look for things that might not be so good to improve our moods. So if we can get at the cause, that's always the best way. And one of the causes of depression, I think, is a separation from the relationship with our God. That if we get back to Him and His truths and His ways, that's going to be a great start for eternal healing. So I just wanted to give you some insights. Share this with your friends and neighbors. Remember this text. God tells us to go out and take care of our neighbors. There's benefits of us. And as we walk along the path, we don't want to walk by someone that might be hurting mentally, that might be suffering from depression. They're out there. We want to pray with them. We want to try to help them. And now I have another tool, a video that you can share with them. Almost everyone now has a cell phone. You can give this, they can download it, they can look at it, they can say, hey, these are some simple things that I can do to maybe help my neurotransmitters. Hey, I can walk more, I can rest more, I can eat more fiber, I can worship, I can do these things, and it will give people hope. So share this with your friends and neighbors. Comment below. Check out our newsletter. You can find that at heartwiseministries.org. And by the way, I have a new book coming out later this year. Keep an eye on it. I've got the title now. It's going to be More Control, Less Fear, Reversing Cardiovascular Disease. So keep your eyes open. I think this is going to be a revolutionary book in the approach to reversal of disease, especially cardiovascular disease. So I'm Dr. James Marcum, and I'm back soon with yet another biblical prescription for life.